Hi, this is Dr. Jenny Byrne. I wanted to talk today a little bit about asking for help and for leaders, why it is so hard to ask for help, especially mental health care help, and what you can do and where you can turn for help. So, first of all, the top message is if you are a leader and you're struggling with mental health, you are not the only one. You are not alone. You may think you're alone because people aren't talking about it, but I guarantee you, behind closed doors, people tell me this all the time. So you are not alone. The second main important thing to note is there are people out here to help you who can understand and empathize where you're coming from, who will not judge you, and who will keep your information strictly confidential. So you're not alone. There are people out here to help. So, where do you start? I think a great place to start, it doesn't hurt to self educate a little bit online. I would recommend that the first step, if you're looking to self educate, is to go to a reputable website. So, some examples would be the American Psychological Association, the American Psychiatric Association. I think the websites at Mayo Clinic are generally good. Cleveland Clinic I've seen as being really nice. McLean in Boston has some nice content online. So I would self educate, but I wouldn't go into like a Reddit black hole where you might get stuck and get some misinformation. So, the first of all, if you self educate a little bit, let's say that you've done that and you think, yeah, I think there might be something going on here. Where do I start? And you're asking me, Dr. Jenny, where is the right place to start? The answer is there is no right or wrong place to start. What I do recommend is having someone do some sort of assessment just or a consultation with you to determine like what is going on. So a good person to do that kind of first level assessment um, might even be your primary care. If you have a really good primary care who's comfortable with mental health issues, just starting there and scheduling an appointment. If you trust them and you feel it's private, that's a great place to have a first conversation. And if there's any real red flags, I think they're going to listen and hear that. Um, Most primary cares, however, don't do full psychiatric assessments. So, what I do recommend is considering getting an assessment with either a psychiatrist or a psychotherapist. If you have comorbid or coexisting medical issues going on, and you're like me, you're a little bit older, and maybe you have some medical issues, or you're a woman and you're going through hormone changes, I actually would recommend going first to a psychiatrist for a consultation because they're going to be looking at hopefully the whole body and thinking more about other medical issues that may be happening with you. If you're medically pretty healthy, or you've already done a big medical workup and you know kind of what's going on with your body, then talking to a therapist for a consult might be a great place to start. So, how do you know where to start? Um, Word of mouth isn't bad. I think word of mouth can actually be helpful. What I know about leaders is they don't really want their information to be shared with others. So I think for leaders, actually, sometimes a virtual appointment can be good because you can get somebody outside of your community. I know many leaders who would not want to go to an appointment because they wouldn't want their car to be seen in the parking lot of a clinic, or they don't want anybody they know seeing them there. So it's interesting that actually leaders often will want to be seen virtually, or maybe even drive somewhere that's like far away from home. I found that when I had my own brick and mortar practice, like a building, people would drive from hours away because they wanted it to be private. So, in terms of finding someone that's a good fit for you, obviously, I'm here to help. If you don't know what to do, you're welcome to reach out to me. If I'm licensed in your state, I can do a consultation. Sometimes going on the Psychology Today website is actually a good place to find either a psychiatrist or a therapist to do a consult. And what I would recommend you do is look for somebody that seems like a good fit. They have filters on there that you can look at different, age and gender and specialty areas. Pick like maybe three of them and then see if you could reach out and do like a 15-minute call to see who might be a good fit for you. I know this sounds like a lot of work, and most people are like, well, why should I go through the trouble of talking to multiple people? Won't I be offensive to them? And you won't. If you just say, hey, I'm interviewing a couple people, I'd like to meet with you briefly, most people have a way for you to do that. So basically, I would just get an assessment first. That's really the first step. And the reason I say that as opposed to like try self help first is because trying self help is great if you know what the problem is, but often the problem is that you don't know what the problem is. And having a professional to tell you what might be the problem actually will help you make decisions. Maybe you only see that person one time and then you go do some self help options, but at least knowing what the core problem is should help point you in the right direction. So I hope that's been helpful. Like I said, I am here to help. If you ever have questions, feel free to reach out to me and I'll try to send you in the right direction or see if I can help you myself. Thanks.